Welcome to Wondermous, a healthcare leadership journey. My name is Merikay Hunt. I'm your hostess for this event. And today I'm really excited because we have an enthusiastic leader in healthcare, James Dismond. James, tell our audience a little bit about you and your organization to kick us off.
So excited to be here. Thank you for having me. James Dismond with Marisol Health. I'm the Chief Executive Officer. I've been with the company for around 5 years and kind of grew up in the ranks through Director of Development all the way now to Chief Executive Officer. Marisol Health is a not-for-profit organization, community-based. We are experts in the palliative care, which is advanced illness, end of life, and grief care realms here in Hilton Head Island, serving 6 counties, with the majority of them being very rural counties in South Carolina.
And as a former adjunct hospital chaplain, it is so important to have care, especially end-of-life care. And what inspired you to go into this industry, James?
I wish I can say that I was inspired. But in all honesty, I was recruited at a local chamber event, and the previous executive director asked me what I was looking for and if I was looking. And I said that I was really looking to build a team in the philanthropy space and drive an organization to a higher capacity. She hired me with the board of directors, and what I unintentionally found out in my first 24 hours with the organization is that my greatest fear, unbeknownst to me, was death and dying.
Wow. Okay.
So we spent that whole week of me trying to quit every day.
Oh, wow. Wow.
Because I thought when I accepted the job, I would be in marketing and philanthropy, and then the nurses would be out doing their thing, and that it would be very separate.
Sure.
But I soon found out that it was the entire team involved in the patients' lives and the care. And that was a game changer for me. And I could hear nurses who had cared for patients crying in a soothing way that
Sure.
past, and that really weighed on me. And thankfully, the executive director then really took me in by her side and helped me understand how death and dying really could be a beautiful thing and should be for everyone who has the opportunity.
Wow. Well, and my sister was an oncology nurse, and then she became a hospice nurse. And, one of the things that she would share with me is that she really felt like it was a blessing and an honor to be with these patients at the end. And I'm really thankful for your transparency in sharing your hesitation and your desire to abandon your new post. Because I think oftentimes as leaders, when we feel that fear and we give into it, we're really missing an opportunity. So I am just thrilled that you hung in there and that you had such a good mentor to help you stay the course. So now we were supposed to record a few weeks ago, and you had some major events happen. Why don't you share a little brushstroke of what's been going on in your world?
Yeah, I appreciate you bearing with me. The government shut down, and that's a landscape change for many organizations, but especially for healthcare organizations who are receiving federal funds in any capacity, but also for grassroots community-based organizations. During COVID, we were able to really vamp up our services through telehealth and telemedicine, teletherapy, and really reach a new audience that we were unable to reach in the past. And so last week when the government shut down, or a couple weeks ago when the government shut down, we received a vast email that came out that all payments would halt. And so my team had to go into emergency planning, just one, see if we were going to be included in those payment halts for reimbursement.
Sure.
We also had to pivot to see how we were going to provide home visits to patients that normally didn't accept home visits, or that we would be traveling upwards 2 to 3 hours to get to that patient. And so I appreciate the time that you lent back to my schedule, because I'm happy to say that we haven't missed one patient visit. And
that's awesome.
we're still operating at full capacity, but nevertheless paying attention to the government landscape for sure.
So, you've mentioned a couple of qualities of good leadership, and being flexible is one, being strategic. What do you feel are some other qualities that you possess as a leader?
Well, I would say, in my first 30 days with this organization as CEO, the one thing that I promised my staff was transparency. And
Mm,
so the government shutdown is a perfect example of that. You, as a leader, you have to recognize some of the fears that your team may be hearing and
hmm.
seeing that
Sure.
makes them uncertain. And so it was
Right.
very important for me to be transparent with my team, i.e., about the government shutdown. You may be seeing this in the media. They're saying that all things are shutting down, but we are operating as normal. Your jobs are
Right.
secure. We're moving forward. So I would say transparency is key, and honesty is at the top. Being honest
Mm,
what you are capable of, being honest of what you don't know,
right.
and being open to understanding that you don't have all the answers.
Absolutely. I was on a call this morning with one of my former coaching clients, and we've re-engaged for a few more sessions. And as she was sharing about her passions and her strengths, she said the word honesty, and I wrote down the word honesty as she was talking. So, certainly having those traits can help us connect to our team. And what that kind of highlights for me too is a high level of, for you, of emotional intelligence. And I think that's a quality that in healthcare, especially, that we need to have, along with the empathy, and not only from the leadership side, but from the caregiver side. So, help me and our audience understand some points of difference of what makes your team at Marisol different from other people in your industry.
Yeah, the hospice industry in general, or the home care industry, which is what we specialize in, really is fundamentally, from a business aspect, the same, right? We
Mm-hmm.
offer a lot of the same core services, but the mentality and the compassion paired with empathy that you should have,
Mm-hmm.
that's where the difference really occurs.
Mm-hmm.
As a business, we do operate a little bit differently. My
Mm-hmm.
leaders and our nurses on our team have the autonomy to decide what that patient and that patient family needs for success. And
Sure.
success doesn't necessarily always mean medical success. It could be
Right.
personal goals that we find do help the medical process as well.
Mm-hmm.
So autonomy is key. We're going to go back to the words trust and honesty, right?
Yeah,
You have to
that'll be
trust.
our theme.
You can do it. I'm okay with
I
it.
like it.
You have to be able to trust your team to provide the services that you've hired them to provide. And
Sure.
so if a nurse comes back and tells our clinical manager, this patient needs 7-day visits with 7 days of CNA services, we're going to
Mm-hmm.
do because that's
Right.
what the nurse is telling us they need. So I
Sure.
think that's really key and really important, is just to trust your team, and then to be honest about your business.
Mm,
Help me understand why you think this patient does need this service, or this amount of support, and really associating what the business is going to have to do to make this happen, but
mhm,
understanding that you mutually agree on the direction that you're headed.
So a couple of things came to my heart and mind when you were sharing that. So when I was in graduate school studying human resource counseling, I interned and did a project with the hospice palliative care in Greensboro, and we did a puppet show to help teach people how to deal with grief. And it was for children, and I learned so much. And the other thing I thought about is I had a neighbor who was a general surgeon. He
Mm.
ended up stepping down from his practice to go be the medical director of that same palliative care organization in Greensboro. And he transformed as a provider, transformed as a leader, and absolutely loved it. So when we think of transformation, I want you to think about your leadership journey and share one of the biggest challenges you faced and how you overcame it.
Well, it was not too long ago.
Here's our transparency again.
Yeah. So I've only been the CEO for 3 years. I'm coming up on
Uh-huh.
my 3-year anniversary, and my first 6 months were the roughest part of my leadership journey, and honestly, my life.
Wow.
Um, I accepted the role. I feel like I prepared well for it,
Mm,
but there was just things I didn't know as a new leader.
sure.
Um, The first one that comes to mind is I had to immediately really lead with compassion and intention because
Mhm.
I was young. I was the
Yeah.
youngest leader that this organization had ever hired. I was
Mhm.
also non-clinical, the first non-clinical chief executive officer in our 40-year history.
Wow.
And so that came with some natural mistrust from
Mm.
my own team that I was inheriting. And so I
Mm.
immediately had to come with action,
Yeah.
and that action was listening.
Mm.
Listening
I
and
got goosebumps when you said that.
I wish I could say listening was easy during that time period, but it was really difficult for me
Yeah.
because I knew that there were some immediate things that we needed to change to survive as an organization, and I knew that most of the team was not aligned with the direction that the board of directors and I knew we needed to go in.
Absolutely.
But I was the vessel hired, and I was the person that committed to that vision and that mission, and it was my job to deliver it to the organization and figure out who was on board. So in my
Mhm.
first 6 months, I experienced 68% turnover of my team
Wow.
with 90% turnover in my senior leadership. And that to a leader is really weighing not only mentally but physically in
Mhm.
the workplace while
Sure.
also experiencing my own death experience with hospice because my mom came onto hospice services.
Oh, wow. Oh, James. Mm.
And the transformation that happened with my mom receiving the services that the organization I worked for provided. And so my leadership thought process completely changed because I got to, what I like to say, step on
Mm.
the other side of the bed and be the caregiver and the family member, not the educated healthcare professional that was on the business side. And so my direction on how to make decisions completely changed because I can now say that the compassion for the caretaker, the caregiver, the family member, the patient, I have that because I've experienced it and understand
Right.
how rough and heavy that can be, even when you know everything that's going to happen.
Well, I didn't prepare and bring my tissues today, but sharing that made me think of my mom and dad. My dad passed away in 2005, and he was actually at Duke Hospital. He had a rare protein disorder called amyloidosis.
Mhm.
My mom passed away, thankfully, at home through the care of hospice. She had pancreatic cancer. And so, certainly having those resources and having, this transformation for you, even though you went through a loss, you had a personal and professional gain because of that experience. So, what a blessing. So when you look ahead, James, what do you feel like are going to be some hot focus areas and top priorities moving forward for 2026?
For 2026 for our organization, I already know the next healthcare crisis that we're in. I think some high level individuals need to realize that we're already in it without getting too political.
Sure.
But we're in a caregiver crisis. We
Hmm.
now have more and more individuals coming under our service that I call elder orphans. They have
Right.
no, they have no support. They're disconnected from their families, their loved one, or their partners
Mm.
are passed, and they have no support to help them navigate the very intricate and difficult healthcare system that the United States of America has. And it's our jobs as home care and frail and elderly professionals to help them navigate that and care for them.
Hmm.
Also, the population is getting older,
Right.
and with the lack of wraparound services in the home, um, that's going to become very difficult for everyone involved in the healthcare systems, from
Hmm.
hospital care all the way to home health, hospice, and other nonprofit providers, potential other nonprofit providers in the healthcare space. But
Right.
it's a healthcare issue in general.
Sure. And, it made me think of we've got shortages with physicians, we've got shortages with nursing. And I shifted to my business mind because you mentioned the chamber. So, when you look at funding for your organization, I'm thinking that you have private funding, federal funding, and then is there some insurance patient payer? Is that the mix?
Yeah, so it's primarily private funding from donors, philanthropy efforts, such as,
Okay.
and then the largest bucket is also from from payers. Medicare is hospice is a federal benefit.
Okay.
We're paid a small allotment per day per patient, and
Mm-hmm.
then that's tiered over the span that they are with the organization. And
Mm-hmm.
then some organizations do have federal funding. We just applied for some federal funding, and that'll be the first time in our history if we do receive it.
Mm-hmm.
So the budget is really built off the amount of patients you're going to be able to serve with
Mm-hmm.
that reimbursement, and then the philanthropy side. But there's something to be said that when government healthcare policy changes, such as Medicaid cuts, lack of Medicaid expansion, um,
Mm-hmm.
reduction in Medicare coverage overall, and Medicare Advantage, people become underinsured and
Mm-hmm.
or they don't have any insurance at all.
Mm-hmm.
And those patients tend to go to nonprofit healthcare providers.
Mm.
Right now, with the way that the political climate is and where we're headed, there's not enough resources in the communities across the United States to serve those individuals who are underinsured or not insured.
Okay. Well, and your business acumen, who have been some influential people that have inspired you with the business, uh, area, and then also in the leadership area?
Yeah, great question. I've been so fortunate to serve under some just amazing leaders, and these are grassroots community leaders. I'm also
Mm-hmm.
fortunate that I've only ever worked in the nonprofit sector my entire career.
Mm-hmm.
As soon as I got out of college, I was already in the nonprofit sector. And one of the most influential leaders, which I should probably tell her at some point,
Yes, that would be wise.
was this amazing CEO that I had at a homeless coalition in West Virginia. And
Oh
she
wow.
led with such compassion and
Oh.
intentionality. I have never forgotten just the conversations that she had with me and how she truly tried to understand where people were. And she said something really profound. And, I haven't worked for her in almost 11 years. Um,
Mm-hmm.
and I was meeting with her and we had a difficult situation. And she looked at me and she said, James, you have to meet people where they are, or you
Mm.
will always be leaving people behind.
Wow.
And that
That's
just
powerful.
changed my direction, because that was the day I decided I want to be a nonprofit leader.
Mm.
Then my thing was I want to be her, right? Because she was
Yeah, that's awesome.
but I remember the day that I accepted a larger position at a different nonprofit, and she celebrated that win. She's followed up with me over the years and just said how proud she was of me. And, it started with her leadership. And then I've been
Mm.
very fortunate along my way to have mostly really great leaders. On the business side, my board of directors has been huge. I've had so many business executives sit on my board and be so willing to transfer their knowledge over to me.
Oh,
I
that's
always,
huge.
yeah, I always tell nonprofit leaders specifically who have volunteer boards, lean in to your board talent and
Mm-hmm.
have that transfer over to you. But you have to be willing to listen. And sometimes that the listening is what you may be doing not to full capacity, and having to learn that skill set that you don't have.
I love that. Where in West Virginia? Curious, because that's my parents met at WVU when they were in school.
I love that. Well, I'm a Marshall boy, so don't hold me against it. Huntington, West Virginia, the home
Okay.
there. Yeah,
Wow.
Amanda
That's
Cummings.
awesome.
Yeah, she was fabulous.
Well, a couple of weeks ago, when I was teaching one of my virtual leadership programs, I encouraged one of our administrators to do an appreciation exercise during their next team meeting. And I'm going to encourage you to write her a handwritten note of appreciation, because you never know the impact that could still make on her 11 years later.
Love that. I will get it done and let you know when it's finished.
Okay, awesome. I'll be your coach and hold you accountable. So, as you think about kind of learning lessons, and this is one of my very favorite questions to ask people, but if you could talk to your younger self, and you might be one of the youngest that I've interviewed so far, but if you could talk to your younger self, what words of wisdom or encouragement would you say?
I grew up in a small town in southern Kentucky, Tompkinsville, Kentucky. When I was growing up, we had like 2 stoplights. And my younger self, I can remember not being able to see past Friday night.
Yeah.
Um, And then once I graduated, it was like I couldn't see past 21. So I was
Mm,
making immediate decisions, not necessarily planning for the future. And although I think I've done very well, I think I could have been far ahead of the game had I
mm,
really understood that success was possible.
mm.
Luckily, I had a good Southern mom that kept me on track. But and those who have Southern mamas will understand that.
I am one of them.
Yeah. But, when I look back at how just unsure of where I was headed and not being able to
Mhm.
invest in that, I would look back at my younger self and say, you have value and you're going to make it. And what's happening right
Absolutely.
now
Mm,
might not be as influential in 10 to 15 to 20 years. I never saw myself leaving. I saw
mm.
myself taking a local job and just staying in that neighborhood. And
Wow.
I would tell myself to explore and explore hard and take risk and
Mhm.
understand that it'll all pay off.
Oh, I love that. I recently read that there's three things we can control: our thoughts, our actions, and our reactions. And I'm just so glad that you leaned into some new thoughts to expand potentially where you could learn and grow and lead. So this has been just a true pleasure, James. Thank you for joining us today on Wondermous.
Thank you so much for having me, and I'll follow up on sending that appreciation.
Awesome. So as we come in for a close, again, my name is Merikay Hunt, founder of Coach MK Companies. And if you or your team wants to rise and go to the next level in personal or professional performance, please reach out to us. Visit coachmkay.com. Blessings to you and make every day count.